You're listening to Greater Boston Today, public service programming on Beasley Media Group stations. We're speaking with Dr. Tony Dodek, Chief Medical Officer for AllWays Health Partners. Let's talk about technology a little bit. And I know that in this day and age, we don't quite have our flying cars yet, but we do have some pretty cool advances in technology, especially in the medical field and healthcare. And I wonder if you could talk a little bit about some of the ways that technology is being used to keep people healthy.
Yeah, technology is the next wave of innovation in the delivery of medical care. Yeah. People are already starting to use their smart devices, their cell phones, and their tablets. That offers an opportunity to use telemedicine, where a medical provider can have a virtual face-to-face visit with a patient, and that can be to provide urgent care, manage a chronic condition, or treat a behavioral health issue. In addition, there are digital health technologies that are being used to deliver quality patient care outside of traditional medical settings. And that includes programs for medication adherence, care coordination, and chronic disease management. Here at AllWays Health Partners, we're collaborating with a group of cardiologists at the Brigham and Women's Hospital to offer a program called iHeart Champion, which is a digitally based management program for high blood pressure and elevated cholesterol. That program has been very successful in achieving control of both of those conditions, usually within about a 12-week period, which is an improvement over traditional approaches.
As we're talking about this, I'm realizing, there are little things like the new Apple Watch has not only a heart, like a pulse monitor, but it actually can tell you if your heart rhythms are irregular. Do you think stuff like that is helpful, or do you think it just gets too confusing?
No, I think that's another potential area where the health community or the medical community can leverage that technology to improve care. There are programs where people have so-called wearable devices that do just as you described, and that information can be transmitted to a clinician who can then provide advice in almost real time. It's been very effective for people with diabetes whose blood sugar can be monitored, and if they're out of the normal range, that information is transmitted to a nurse educator who can then contact them either by phone or text to tighten up their management.
So you're saying these things can be used for more than just checking Facebook, eh?
That's right.
Something more important.
Right.